Hey YouTube friends, do you think you might be suffering from knee tendinitis? Knee tendinitis is hard to tell apart from other things that cause knee swelling like arthritis, meniscus problems, much more issues that can happen in the knee that cause knee swelling. But if you think you've got knee tendinitis, I'm going to give you 3 things that you can check for to verify if you've got knee tendinitis. Now, if you've got this problem and it's really causing a lot of issues for you, you do want to go see a specialist about this just to make sure that you're safe and that nothing more serious can happen, and to make sure that you get this better so that it's not stopping you from what you love to do. Real quick, my name is Dr. David Midoff, and I've been helping out people with knee problems for years. In fact, we've got a program online that we offer called the 28-Day Knee Health and Wellness Boost program. In this program, we've got all our exercises condensed into an online program that you can just follow the videos and help your knee problem resolve so that you can be active and mobile and not be slowed down by your knee. So let me tell you the 3 signs to check for knee tendinitis in your knee on yourself right now. The first thing is to just think back. Have you had a change in your activity lately? Think about when the knee tendinitis problem or your knee issue potentially started. Was it just a few weeks ago or maybe longer, a few months ago? During that time, did you have a change in your activity level? Like, did you start a new exercise program? Or did you become more active somehow? Did you begin to do some yard work around the house that you haven't done in a while? Have you been using your legs more often? A classic thing that happens, especially with our younger people, our younger viewers, is they're participating in some sort of seasonal sport, and when the sport picks up, when the season comes on, that's about the time when the knee tendinitis problem started. If you got some situation like that where you began a new walking routine, or you got a new pet and you got to take them for a walk and you're walking a lot more than you normally have, that could be an activity level increase that you had recently. So think back to that. If you've got a situation like that where you just started to do more activity, and it may not even be that much, you'll be surprised if it is a lot more activity. For instance, if you've already been exercising, but then you do a different exercise that just tires your legs out more so than you're used to, that's also a change in activity. If you've got some situation like that, then count that as a possibility that that is what contributed to a knee tendinitis problem. The next thing to look for, number 2, is tenderness right below the kneecap. Now let me just show you on my skeleton here. Give me a second to get this for you. Here's the thigh bone, the kneecap, and then the shin bone, or the lower leg bones, tibia and fibula, femur and patella. This is the kneecap, your patella. Now the thigh muscles in the front of the thigh connect to the top of the kneecap, and then there's another connection from the bottom of the kneecap down to this part of the bone right here, and that's where people usually get the tendinitis problem, where it develops. If you just poke the bottom edge of the kneecap and then just continue to feel down and poke it gently until you get to the shin bone right here, the top of the shin bone, if that area, anywhere in there, it doesn't have to be the whole thing, it might just be an edge or in the middle or on the bottom edge, if that is tender to touch when you poke on it, that is very likely knee tendinitis. Now, there's a lot of tendons in the knee, but that's the most common place to get tendinitis problems in the knee. There's other places you can get tendinitis. Now, the hamstring muscles are on the back of the thigh, but they send tendons down below the knee on the sides of the shin bone, and the upper part of the shin bone right here. And so you can get pain and discomfort on the inside, on the outside of the knee as well, and that could be tendinitis, but that's a lot more rare than the type that's running right along the front of your knee below the kneecap. So watch out for that. The third sign that you can check for knee tendinitis in yourself is if you go to squat, and be careful with this because it might set off your symptoms, but if you just stand up while you're watching this video real quick and just begin to squat down just a bit, what's going to happen in your leg is your knee's going to bend like this. When that knee bends, it's going to put some tension through the front of the knee, through the entire knee really, but you'll feel that tendinitis spot begin to hurt quite a bit. So watch out when you do this, be careful and go slow. And don't push into it all the way. If you begin to feel a little bit of pain or discomfort in the front of the knee, you're done. You don't have to keep checking. It's a positive test. You found the pain, and you can pretty much confirm that you've got knee tendinitis. Now, the way that this will get diagnosed, if you go see your doctor or some specialist about this problem, is virtually the same thing. They're going to ask you these questions that I've asked you. They'll poke around the area, and in some cases you might get some x-rays or other imaging just to confirm that it isn't something else, like arthritis or that meniscal problem that I was telling you about. And here's the good news. If you've got knee tendinitis, that swelling will go away and it should be able to get better, usually 100% better, but you've got kind of a long road in front of you. Now, to fix the root problem, you've really got to change your muscle strength throughout your legs, and that's a process. That's a long-term process. Now, in the short term, what you want to think about doing is laying off the activity that you're doing. If you begin a new exercise routine or you're upping your exercise somehow, you have to look at taking smaller incremental steps and increasing that activity. So if you took a big step, if you decided to run 2 miles instead of 1, for instance, start at 1.5 miles or maybe even 1.25 miles. You need to take smaller steps and figure out what works for you. Now, this will get better if you rest it completely. So in other words, if you have pain right now and you're thinking, well, I'm gonna stay off of it, I'm not gonna exercise, and dog's gonna have to wait before I take him on a walk, that's cool. It'll go down in inflammation and it should feel better. But as soon as you come back to the activity, you've got to make sure that you do a little bit at a time and then a little bit more. And what needs to happen at the end of the day is that tendon that's irritated needs to slowly adapt to the activities that you're putting it through so that it doesn't get overworked. Because that's literally what happens in tendonitis. The tendons just are not prepared to do what you're putting them through. It's a lot like getting a callus on your hands. Like if you go lift weights or do some yard work, or on your feet, for instance, people get callus on their feet all the time. If you're doing some activity that rubs the skin on your hands and your feet quite a bit, over time you get a callus that develops and it allows you to do that activity better without busting your skin. But if you do too much too soon, if you do too much really fast, then your skin will blister or even tear and you get a bloody mess after that. Same thing is happening in your tendon, except it doesn't look like a blister or a bloody mess. Obviously, it's on the inside of your knee. But if you do too much through that tendon, if you put too much forces on that tendon and it's not ready to do it because it hasn't calloused yet, it hasn't gotten thicker and stronger to take the forces you're putting it through, then that tendon becomes irritated, it swells, and if you keep going, it can tear or rupture is what the medical field says. To fix the root problem, you've likely got to get stronger in core muscles, and your glutes is a big core muscle, the abdominal muscles. You've got to think about how to involve those muscles in your everyday activities. Another thing that you want to do is avoid quad strengthening. Quad muscles are the ones that are on the front of the thighs that attach directly to that kneecap, and it puts force through that tendon. So if you've got very strong quad muscles, or you have a history of when you go exercise, you feel like your quad muscles work quite a bit, or you even isolate your quad muscles because you're doing knee extension exercises where you're straightening out your legs with that pad on the front of your shins, and it's causing your quad muscles to get really tired and tight. That is not a good idea. You want to start to avoid those activities because it's going to irritate that tendon even more, the knee tendonitis problem. There's a false sense of accomplishment when you do this because some people have the mindset, even people in the medical field, physical therapists and other medical people out there will recommend this to you. They'll say, oh, you have knee tendonitis, let's go strengthen your quads. Go do some knee extensions. Let's do exercises that strengthen the front of the thighs, because up front, that will probably make you feel better. In fact, you may have had the experience, especially if you got your knee tendonitis problem through increased exercise, where that knee tendonitis problem comes on after the exercise, or when you're not exercising, when you're recovering between days where you exercise or times where you exercise. And then when you go to exercise, it kind of hurts a lot when you start, but after a few minutes, it feels better and you can continue to exercise. So there's this false sense of accomplishment, or this false sense of security that it's going away and that the exercise you're doing helps it, but it's really not. It's just your body releasing endorphins, and what's going on the inside of your body is your body's saying, uh-oh, we're going to run, we're going to walk, we're going to do this exercise. I told you it hurts, but they're not listening at the beginning because I sounded the alarms of pain when you first started to move, but a couple minutes have gone by and they're just going through it. It looks like we're gonna have to run. So let's shut off the pain. That's what your body goes through, and it's not a good thing. You want to listen to that initial discomfort or pain that you've got in this tendonitis problems. There are other issues where you do have to kind of work through some pain, but this is not one of them. It's going to get worse over time if you force yourself through that painful beginning of exercise with this knee tendonitis issue. So what fixes knee tendonitis? Well, one is something called high repetition, low intensity exercise. A great example of this is bicycling. Another one could be ellipticaling, using an elliptical machine. Walking is kind of one because there's a little more resistance or intensity because of the impact. Of course, running is even more impact than walking, so I would avoid that one. But bicycling is a good place to start. If you want to use a bicycle, a great thing to do is just go nice and easy, no resistance, find a rhythm that works for you, and go like 10 minutes to start. See if you can increase your time from there. Key thing though, just like I said earlier, you don't want to force your quadricep muscles, the ones on the front of your thigh, to do the majority of the work. And that's easy to do on a bike. It's so easy. If you just don't think about it, you will use the front of your thigh muscles. They'll start to warm up and burn quite a bit. And what you need to do is think about when you pedal through a bicycle, when you are pushing your foot away from your body, you need to think about squeezing your glute muscle to accomplish that. And then alternate, because you're going to push your other side down. After that, you got to squeeze the other glute, the butt muscle. So every time you pedal, it should feel like your butt muscles are just squeezing, 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 squeezing. And if you force yourself to do that, it automatically begins to shut off the quad muscles, the ones that you don't want to work out too much, so that it doesn't put too much stress or pressure on the knee tendon. Hugely important to make sure that that knee tendon calms down, so that you're not getting worse and closer to rupturing it. Now, some medical professionals will say, oh, this should be over and done within 2 to 4 weeks, or they'll give you certain time frames. And what I always tell my clients is take as long as you need. If you can avoid a surgery, take 6 months, take a year. If you're making progress and heading in the right direction, if it's a really, really, really bad tendonitis problem and you don't want to have surgery, well, obviously you haven't ruptured it, hopefully. If you've ruptured it, you'll know, and you'll be at the ER, at the surgeon's office real fast to get that repaired, and you want to get that repaired very likely. But if you're not ruptured yet, it's just swollen, irritated, painful, it's been going on for a while. It might even be turning into what we call tendinopathy, which is a long-term tendonitis that causes some degenerative changes inside of a tendon, and that's what leads to the rupture usually. If you want to avoid that situation, take as long as you need offloading that quad tendon and not working out your quads. And you have to resist that urge, because especially for people that exercise, they reflexively want to go strengthen their quad muscles and make sure they feel the burn in there and get that feedback that they worked out, that because their quad muscles are burning or tight or tired. But you need to flip it in your head and think, I need my glute muscles to get tired and firm and hard so that my quad muscles actually kind of weaken. I mean, you don't want them to weaken completely. They won't if you're working out like this. But you don't want to further increase the strength in your quads at the expense of not strengthening the glute muscles. You've got to get those glute muscles stronger and move your knees better so that that tendonitis goes away gradually and you remain active and mobile. So look to avoid other exercises that put a lot of pressure on the front of the knee, like squats, lunges are another one as well. Any sort of exercise that really activates those quads. Another one, especially in gyms, is the leg press machine. If you think about a leg press machine, it's that one where you can put plates of weight on the sides, and it's got a big platform where you put your feet and you sit in it and then you push your legs away. That machine makes you use your quads a lot. There really isn't an easy way to do it without using your quads. It forces you to use your quads. And the thing is, people jump on that exercise machine all the time and they put lots of weight on there and they think to themselves, how gratifying, I just pushed 4 plates on each side or 10 plates on each side. It's ridiculous how much people can actually lift on that machine. But they felt their quads burning and working real hard, and it's putting a lot of tension and strain through that knee tendon on the front of the knee. So it's going to make things worse. And people grit through it. At the beginning, they'll feel their knee pain come on, and they just keep going. And then the body says, we're going to do this. We're picking up 10 plates today. And then you end up feeling better. But then after the fact is when people pay for it. Later on, at the end of the workout, sometimes immediately afterwards, sometimes it's hours afterwards that their knees just start to hurt. And then simple things like getting up and down out of a chair, in and out of a car, up and down from the toilet, bending your knee to put your pants on or your underwear on starts to become painful. That is a sign that you're not doing the right thing for your knee tendon. You got to give it some time and offload the front of the knee and stop working out those quads so that you're not making your tendon problem worse. So guys, I hope this video was helpful for you. If you've got a knee tendon problem, please take the advice here and start working on this so that it doesn't get any worse. I don't want you to have knee tendonitis longer than you should. Please share this video with somebody that you know that might have a knee tendonitis problem so that they aren't getting it either. And please give us a like right here and hit the subscribe button right over there so that you can get notified whenever we release helpful new videos to help you become more healthy, active, and mobile so that you can avoid injections, medications, and surgery. Have a wonderful day, YouTube friends. Bye-bye.